Hey everyone, my name is Kelly Reed and I am a physical therapist and I specialize in oncology and lymphedema. Axillary Web Syndrome, or also known as 𝐏𝐿, is a common condition that occurs in up to 50 to 80% of individuals who go through breast or melanoma cancer. It is typically caused by one or more lymph nodes removed from the armpit area. The cord typically will run down the arm all the way to the hand, or you may see cording go down the side of the chest wall. Although the cords are not always visible to see, they may cause limitations and pain with movements of the shoulder, especially as you try to reach above your head or out to the side. Cords are frequently seen 2 to 8 weeks after surgery, but some can show up months to even years later. Many cases of cording will go away on their own about 3 to 6 months after they show up, but some can persist chronically, and that can cause pain or limitations in shoulder dysfunction, or other painful conditions. Thankfully, recent research has shown that axillary web syndrome does not cause lymphedema, nor is it related to cancer recurrence. So what is cording? The medical field is still not certain what exactly cording is. Research is led to believe that it is a lymphatic vessel that is clotted with fluid that was damaged during surgery in the armpit or axilla area. So how do we treat cords? But more importantly, how do we get your function back and reduce your pain? So the first thing we teach is we start out with gentle exercises to help stretch out the pec area and open up the chest wall. So for the first stretch, what you want to do is you want to lay on your back and you want to put your arms straight out to the side with your palms up. And then what you'll do is you'll just let gravity pull your shoulder blades back and relax. You can take a couple deep breaths. And when you let that breath release, let it relax further into a stretch. Then what you can do is you can gradually bring your arms out to the side, all the way up to about 90 degrees if you can tolerate, and allow yourself to stretch there. You're gonna feel a bigger stretch across your pec, but you want to focus on taking a breath and letting it all relax. Now the second stretch is my favorite. You'll likely see it if you do follow me on Instagram, that I have used it a couple times. I do give this to just about everyone after radiation or after surgery. So what you'll do is you'll lay on your side with your affected side or your tight side up on top. So if you have the cord on this side, it will be up. And you'll place your hand behind your neck with your elbow pointing forward. And then you'll gently start to rotate open, keeping your knees together, until you feel a mild to moderate stretch across the chest wall or across the pec. Don't want to go too intense there. If it is, back off. But then what I like to do is add a deep breath. And when you let your breath go, let it all sink down. Hold it for a few seconds and then gently come back out. And I do that a couple more times. And the third and final stretch is a little bit more intense, but if you're looking for more range of motion or you're not feeling the stretch with the others, you're gonna lay on your side, again with your legs stacked on top of each other, whatever's comfortable for your arm. Maybe you want a pillow. And then with your arm out to the side, you're gonna make a big circle going all the way across, trying to keep your hand touching the ground as long as you can, and rotate around all the way back. And I go 2 to 3 in one direction. And if you have tightness here like I do, sometimes you'll just take a break there, let it release, and come back around. And then I'll try going the other way. So keeping your hand touching as long as you can to the ground. And nice and gentle all the way around. Again, stopping in the back if you do have a nice big stretch here. Add some breaths and then release. Try your best to keep your knees down. I know I wasn't perfect with it, but it's a little bit tensed up. The second thing we do is teach nerve flossing or nerve glides to help mobilize the tissues. So we're looking at doing a floss or a nerve glide of the median nerve, and that's the one that runs down the middle of your arm. So you can do this laying down. It might be a little bit easier, but I'm going to show you sitting up. So I'm going to have you bring your arm up to about 90 degrees, and then you want to start to bring your arm back, or if you're laying down, just allow it to fall off the side of the bed a little bit. Now, if you feel any tension or pulling down your arm, you may stop there and try to relax. You should only feel a mild to moderate tension, not anything too significant. And if you do, you want to back off a little bit. And then what you'll do is you'll bend your wrist back away from you. You may then feel tension or a little bit of a zing all the way up your arm. That is the nerve tension. A lot of people have this anyways, even if they don't have surgery. Now, if you have a lot of tension there, again, make sure it's mild to moderate. So what you can do is you can bend your wrist forward and then back on the tension and then off the tension, on, and gently going back and forth through that about 10 times, making sure that, again, you can stay relaxed with this. Now, if you don't have tension or you didn't feel that with that, then you're going to add head movement. So you're going to bring your opposite ear to your opposite shoulder away from that arm. So the arm will go back, my elbow's straight, my wrist is bent back, and then I'm going to tilt my head away. And for me, I do get the tension down the arm. So again, mild tension, and then off tension, on tension, off tension, and therefore going about 10 times. And then give a break and you can do it again later. Try not to sit there and do 100 of them because you will be probably pretty sore. A third thing we'll typically do is myofascial release or soft tissue mobilizations. A therapist will use a light massage technique to help move tissue, especially on the top layers of your skin. We'll look at around the cord site and find any adhesions that may be stuck down and gently try to work to release those. If you are less than 6 weeks out of surgery, we are typically a little more conservative. We want to stay away from any surgery sites or any incisions that are not fully closed. We'll typically also teach these for home or caregivers to help assist. You want to start with the top layer of skin and be gentle, and we will start with just gentle circles in this area to help mobilize skin or tissue around that cord. If that's still not enough, we may add, if safe to do so, of tissue rolling, where we'll try to pick up the skin from the tissue below and roll it across. Again, try to break up those adhesions or the scar tissue to then release the cord. We will work into the arm and down the side of the chest wall. Now you want to make sure that if you're working near the armpit area, again, that you're not new out of surgery. You also want to make sure that you're never pushing too hard in there, as you do have delicate structures, including lymph nodes and nerves. Another thing that we'll use is Dicem, which is a sticky fabric that when you put on your skin and you move around, it will grip onto your skin to help mobilize that tissue a little bit easier, especially if you only have one hand and you're doing it to yourself. When using it, we typically will just place it directly on the skin where the cord is, either on the side of the chest wall or under the arm. And then what we'll do is we'll teach just gentle circles or just a gentle stretch of the skin in various directions to try to help release that tissue or those adhesions to then try to release your cord. The fourth thing we may try, because they feel that the cording stems from a lymphatic vessel, so we may try manual lymph drainage for what we do for lymphedema, or compression bandaging to help release and move the lymphatic fluid. Typically we'll bandage the arm all the way to the shoulder for about 1 to 2 days, and sometimes that is helpful to help release some cording. If you're interested in compression bandaging, I would recommend following up with a lymphedema therapist who can help show you the techniques of this. Manual lymph drainage is a light, gentle massage technique to help move fluid under the skin through the lymphatic vessels and to the lymph nodes. I'll have another video in the next couple weeks that will be done for lymphatic drainage, and you can watch that to learn more techniques. A fifth thing we may try is scar mobilization, or a cupping-like system to help release scar tissue or adhesive tissue. Myofascial release and manual lymph drainage are more gentle, and we will start with those first, but some people have a little bit more thickened tissue or scar tissue in the area from radiation or from the surgery itself, and after it is safe to do so, we may go in with a instrument or assisted cupping technique to help pick up that thickened tissue and mobilize it so it can soften and hopefully make more pathways for that lymphatic vessel or the cord to release. So what is the pop you may hear or feel? It has not been adequately researched to know if that cord just broke, causing the pop, or if the tissues around it released to allow the cord to let go and move. In therapist experience, a pop or a snap is usually followed by instant relief in pain and also then moving back to full range of motion. Due to the lack of understanding what breaking a cord really is, and although there have been very few negative side effects for those who get a pop, we are still typically more conservative, especially when you're new out of surgery. It's best to work with a physical or occupational therapist that specializes in cancer or lymphedema to safely manage and educate on how to specifically manage your symptoms. Although for many, cording will go away very quickly, for some it can persist for years later. If you have cording and you have shoulder issues or any chronic neck pain, you may want to get that looked at and help get techniques to release your cord, as that may help change your shoulder and your neck function. If you have any other tips or techniques that you've used, or if you have any other topics that you'd like to see covered in cancer or lymphedema, feel free to comment those below. Thanks, guys.